equity as attainment of highest level of health for all people. Achieving health equity requires valuing everyone equally with focused and ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and elimination of the health and healthcare disparities. More simply, health equity is when all people have the opportunity to attain their full health potential, and no one is disadvantaged from achieving their potential because of the social position or their socially determined circumstances. Today's conversation is intended to explore the current state of 5G deployment in the US and how it is impacting healthcare industry's ability to provide more accessible, high-quality care for all individuals in need of healthcare services. Additionally, we will probe into what is on the horizon regarding how and where healthcare services can be delivered. To discuss this topic today, we have pulled together a distinguished panel represented by T-Mobile, the nation's leader in 5G coverage and speed, Wellstar, one of the largest and most integrated healthcare systems in Georgia, and Remedy, a Georgia-based digital health company focused on managing chronic health conditions through their clinical management platform. Let's take a few minutes for each of our panelists to introduce themselves and their companies. Let's start with Bill.
So thank you, and thanks for having me. It is certainly a distinguished panel. So Bill Volando, I am the Vice President and Chief Technology Officer for Wellstar. Wellstar, for those of you who may not know, one of the largest health providers in the state of Georgia. We have 11 hospitals, about 250 medical office buildings and healthcare centers, and employ well over 20,000 people within the state of Georgia. So for us, very excited to represent Wellstar, very excited to be a part of this panel as we talk about 5G and some of the things that 5G will bring to us.
Thanks, Bill. Lucy?
Thanks, Greg. I'm Lucy Ide. I'm the CEO and founder of Remedy. We are a digital health company based here in Atlanta. And I come to this as a clinician by background, trained at Emory and then up at UPMC, and really bring a passion for how we improve data access, data analytics, and workflow for clinicians. And this ties into the topic today because part of that is how do we bring data from the patient home and outside of the hospital and health system to clinicians at the point of care to help them make that best decision about patients. And with the growth in remote monitoring and telemedicine during COVID, 5G has become a big part of the future of that.
Great. Thanks, Lucy. And Jeff?
Hey, thanks, Greg, and thanks for having us on the panel today. So Jeff Rosowski, I'm the Senior Manager, Healthcare Director for T-Mobile. I as welcome with a clinical background, 20 years experience as a physician assistant in internal medicine, primary care, urgent care, and pain management. I've had stints with GSK, Boston Scientific, IBM Watson Health, and have joined up with T-Mobile to really hopefully set apart our organization from others in regards to hiring clinicians on staff. So thanks for having us, Greg, and look forward to the conversation.
Great. I really appreciate all of your participation today, and I really look forward to an insightful discussion. But before we get started, I would like to introduce ATDC, the Advanced Technology Development Center. The Advanced Technology Development Center is the state of Georgia's technology startup incubator and is housed and administered by the Georgia Institute of Technology. It was founded in 1980 by the Georgia General Assembly, which funds it each year. ATD's mission is to work with entrepreneurs in the state of Georgia to help them learn, launch, scale, and succeed in the creation of viable disruptive technology companies. Since its founding, ATDC has grown to become one of the longest running and most successful university-affiliated incubators in the United States, with its graduate startup companies raising over $3 billion in investment financing and generating more than $12 billion in revenue in the state of Georgia. ATDC's health tech vertical consists of close to 50 health technology portfolio companies who have raised over $300 million in funding over the past 3.5 years. Additionally, ATDC recently launched the creation of the 5G vertical. ATDC, in partnership with Georgia Tech, T-Mobile, and the Curiosity Lab of Peachtree Corners, jointly launched the 5G Connected Future Incubator Program. designed to find, evaluate, and help scale startups in the 5G space. Please go to www.atdc.org to learn more about ATDC and how we can help you grow your health tech or 5G startup company. All right, that's out of the way. Let's get to the discussion. We have already provided a general definition of health equity. Here's a question for Lucy and Bill. Please share your thoughts and observations about the current state of health equity in the U.S. and what is impacting your company's ability to deliver cost-effective, high-quality care to all who need it. Bill?
So I'll jump in with a technology lens. I know Lucy probably has other lenses to look at as well through this, but from a technology standpoint, there's a few barriers, right? One of those barriers is something that we'll talk about today, which is the lack of bandwidth to more of our rural areas. So when you think about things that are very important to WellStar, but very important to every healthcare system, is the propagation of telemedicine, telehealth. That's a challenge when you have bandwidth constraints. So if I had to tell you one of the things that we look at and one of the things that we are continuously focusing in on from a technology standpoint in rural Georgia is the disparity of bandwidth out to some of our more rural areas. There's plenty of other challenges, right? When you think about the availability of PCs, the availability of tablets, of communication devices, that can also be a challenge. But I would tell you, and probably for the focus today, one of those challenges is the bandwidth.
Great. Thanks. How about you, Lucy? Same question.
Sure. So happy to build on that. And I've been really involved over the past year with an initiative out of the Consumer Technology Association and Connected Health Initiatives called HEAL, which is focused on health equity and access. And so we've been looking at both policy aspects of this and sort of practice aspects of this, right? So the work being done by the FCC and others around access to broadband last mile really is a lot of the challenge there, right? So all sorts of work there, right? TV white spaces, other bandwidth that's available that can sort of provide that connectivity to the rural communities is an important part. And I think there's good work being done to address that and by T-Mobile and others, right? And then there are the other aspects of, okay, so if you have that bandwidth, what else would stand in the way of equitable access? Digital literacy, not just health literacy, but digital health literacy is a piece of that. And, so we're making recommendations through this working group, which is about 50 companies, of both product design aspects to that digital and health literacy, but also policy, right? How do we incentivize people to build digital health applications, telemedicine applications, medical devices that include equity in the design principles of those. So I think that's a big part of it, that if we think about the different barriers, if we address the bandwidth and connectivity, then there will remain other barriers that need to be addressed. And the last one is from the policy side is the reimbursement. So part of what we're talking about today is how do we get this data flowing from patient homes back to healthcare systems. And currently, both rural health clinics and federally qualified health centers can't bill for that kind of monitoring, which is ludicrous, right? Because they serve the patients with the hardest time accessing healthcare, with the most needs to be able to remotely connect. So there are big policy issues like that need to be addressed as well.
Great, thanks. Jeff, do you have anything to add on that?
Well, just to echo Bill and Lucy's thoughts, those are definitely factors that we're working on with a multitude of different companies that present solutions regarding telehealth, telemedicine, kiosks, booths, et cetera, that, in public-private partnerships. If you look at what we did with the VA and Philips and Walmart, trying to address some of those needs specifically around the veterans that don't have immediate access to their centers or that live, an hour and a half away. And so, trying to bridge that gap and eliminate one of those barriers to access and equity is definitely something that, we'll get into, I think, in a little bit.
Great. Okay, so on the T-Mobile website, Jeff, 5G is defined as the next generation of wireless network technology that will fuel innovation and transform the way we live, work, and play. What would you like to add to that definition And can you share what makes T-Mobile's delivery unique?
Yeah, sure, Greg. So the way that we've deployed our 5G is drastically different than our competitors, regardless of what you see on television. And so what we refer to it as the layer cake approach. So when you look at the spectrum and radio waves that are being sent out from our towers, we have three of them. So we have your high, mid, and low band spectrum. And with the acquisition of Sprint, we have the most coverage in all 50 states. So if you think about it from the most simplistic term, that low band coverage is really where we're going to be able to hit our rural markets, right? So if you can imagine a cell phone tower putting out the 600, the low band spectrum of megahertz of spectrum, you're going to be able to reach miles away from those towers. And so one of the mandates that we had with the acquisition of Sprint is to address rural America. And it's one of the mandates that we have to have that coverage. And so when you look at the technology that we have available today from a 5G perspective with home office internet, it's being utilized by payers and providers to actually provide access to some of these rural markets. And we're doing a lot of these pilots for connectivity to address these health inequities.
Okay, great, thanks. And you talked about some of the pilots and things. A question that continues to still come up about 5G is 5G really here, or is it still all marketing? So how do you all respond to that and the timeframes that T-Mobile is looking for to be able to fully take advantage of all the promises that we've started to discuss already?
Yeah, so as I mentioned, I think we got a fantastic foundation from a network perspective, right, with our layer cake approach. So you got the low band spectrum, mid and high. That high frequency is where you're going to see the fastest upload and download speeds, right? And so when you look at it from, is it really here? Well, 5G phones and tablets have really just come out, right? Routers are now starting to come off from partners and be able to provide those connectivity points now that we have our solid network. And so it's definitely here because we are in a multitude of various pilots and projects, as I mentioned, around remote monitoring and telehealth with just basic connectivity, but we're also in mobile edge computing now for image data transfers with cloud service providers, as well as your nationally known, imaging organizations. So it's definitely here. It's just the implementation, I think, is right now probably in its preliminary stages, but over the next 3 to 5 years, it's definitely going to grow and expand.
Okay, great. Lucy, one of the things that you and I discussed was the increased broadband will move health tech toward continuous data streaming and batch data burst, or versus batch data bursts and uploads. So both Lucy and Bill, I think that this is to understand what impact that has and how that increased broadband can make a difference, whether it's from that continuous data stream perspective or others. What are your thoughts in terms of how that is going to impact your businesses and how delivery is provided?
So, the majority of remote monitoring that you see today are these sort of episodic, very small packet data transmissions, right? A patient taking their blood pressure at home or their blood glucose at home or a weight and that little packet of data being transmitted. So, we do have the connectivity issue and that needs to be addressed and will be addressed in these next generation 5G devices that reach to some of those homes that don't have coverage today. But there's also all of this movement around hospital at home and moving patients more quickly out of acute hospital settings back to the home, but much sicker patients, right, who require more intensive and continuous monitoring. And that, requires sort of us moving to a model where some of that computing can be done at the edge and the insights or analytics around the data are what are being transmitted. Not transmitting the entire continuous data stream. So, we certainly, as we look out, a couple of years, anticipate that the move will be towards those more continuous monitoring models, but it will require both the technology to be there, the price points to come down on some of the data transmission, as well as the devices to make that broadly available to pull it back to our equity issue, right?
Right. So we are touching on some of the barriers and concerns that y'all are facing with the current state of 5G. Bill, is there anything that you would like to add in terms of how the concept of continuous data stream may drive new ways to deliver care in the future?
Yeah, absolutely. I think I'll play on some of Lucy's thoughts because they're spot on. They are just spot on. That first of all, to kind of go back in time, if you will, and think about whenever we first got LTE, whenever you had 3G coverage, and then all of a sudden LTE showed up and you went, oh my gosh, that is fast. That is phenomenal. And now, several years later, you think, wow, LTE is pretty slow. The reason for that, though, is because the content has become much more rich, right? Where it used to be that you would look at a photo and it would take 3 minutes to get the photo in. Now you are streaming video at 1080p, sometimes 4K, and quite honestly, in the future, it'll be 8K. So now to go back to Jeff's original thought process of as we start to introduce devices that can handle 5G, that are natively 5G, I think we're going to see some huge benefits there. So check mark, great. But to Lucy's point, that's going to take another 3 to 5 years, just as we've introduced the LTE world. It took a few years to do that as well. But I would tell you that as much as bandwidth is interesting, it also allows us to do some things on the edge of the infrastructure that today we really have to do in our data centers, whether that be a cloud data center, whether it be our own owned data centers. But if you think about network topology today, network topology is typically bringing everything into a centralized location, doing your compute, storing it there, sending it back out. That can take anywhere from milliseconds to ultimately really seconds to deliver, which is a long time in healthcare. As I think about our move to 5G, we're going to be able to, my belief is that we'll be able to then look at solutioning on the edge, whether it be compute, storage, image delivery. Jeff alluded to that earlier, where we can start delivering not only the images, but the analytics, the AI associated with those on the edge, as opposed to having to go back to massive data centers, do massive compute, and then finally ship it back out. So I think that over the next 3, 5, maybe 7 years, we'll see, as the adoption process happens, we'll see faster response times, we'll see metadata that is more easily digestible, and then ultimately delivered back to the patient in a lot of the ways that Lucy just outlined a few minutes ago.
No, that sounds great and very promising for the future. Jeff, you know, the concerns that I've heard so far has really been about bandwidth, and I think you've addressed how T-Mobile is addressing that. Another component that I've heard some concern raised about is the cost of service. So is there, you've talked about a mandate is being able to reach rural areas, T-Mobile to be able to reach rural areas. Are there, what's the current thinking in terms of how the costs associated with that infrastructure will be made affordable to those in those areas, or those that don't have the luxury of being able to pay for their bandwidth?
Yeah, great question, Greg. So Lucy and Bill both alluded to the fact earlier about rural America and broadband, lack of connectivity. Fiber lines are not going out to a lot of these markets, and so inevitably, what ends up happening, just like with any other industry, you tend to see a reduction in cost once there's more people entering into the market. And so when you have a multitude of providers within urban areas with various fiber lines and connectivity plays, it's a race to zero, right? Who's going to offer the best deal? Who's going to offer the lowest, 6 months, 12 months of connectivity, and then try to upcharge it from there. And what we say end up happening in the future is, again, having that connectivity and being able to address these rural markets, it's going to provide access. It's going to reduce costs, actually, and we're going to have the capacity in our towers to handle the data transmissions that Lucy and Bill are alluding to, for hopefully, preventive type of analytics, early warning signs, and really addressing a lot of the folks in these markets that tend to go to health systems a little when it's too late, and try to address some of their care at home more efficiently.
Great, thank you. So would any of you be interested in sharing some of the initiatives or projects that you currently have on your roadmap in respect to, you know, pilots or activities? You've mentioned a few things, but can you address some of the roadmap initiatives that you have that you're facing or are currently underway in regard to 5G and providing equitable access to care?
Yeah, sure, Greg. So I'll start out from that one. So in one of the pilots we have with a payer is actually trying to address care for the homeless. And so again, in this obviously be more in a urban setting, but a particular health plan is formalizing a team of clinicians to actually meet the homeless where they are in LA. And so having that 5G connectivity, tablets coverage, potentially GPS of where these people are to help address their needs, their care across a multitude of symptomatology, and before they hit the ER, right? We're trying to course correct these individuals to ensure proper care, more education, whether that's nutrition, for diabetic care, or from a salt intake for hypertensive folks, or if it's substance abuse or mental health. Providing them with access to these folks, I think, is a pretty neat project that we're working on, and hopefully ends up starting out in Q1.
Great.
Good, and maybe I'll jump in next and give a little bit of history from a WellStar perspective, a little bit about what we've done to date, and then also talk a little bit about some of the partnerships we're forming at this moment. So first of all, WellStar in 2019 commissioned a study to really look at health equity and see exactly where WellStar specifically was in that continuum. And out of that study, then really drove a lot of efforts that we have been putting forth over the last, I guess, almost 2 years now. I will tell you, for us, there's a few key focuses that we've looked at, and they are driven by what we call the great accelerator, right? COVID has been the great accelerator of adoption of new technologies, but it specifically in 2019, WellStar founded a Center for Health Equity within the WellStar system, and we started to focus in on some of the areas that we knew had some great disparities out. One was, as COVID was rampaging throughout America, we realized that we needed to understand how to distribute vaccine and the vaccinations themselves. And so that has been a very big focus, as well as testing for COVID, to try to at least begin on the stages of health equity. The next thing that we decided is that we needed to have a voice in our smaller, more rural areas. So we've been hosting and participating in a group of town hall meetings where we are partnering with different counties and different city municipalities as we try to understand and build plans that are specific to the areas in which we serve. And then finally, to give you just kind of the history, and this one is relatively new history, and also ties back to ATDC, is that over the last, I guess it was 4 months ago now, we launched Catalyst by WellStar. So Catalyst is a digital health and information system platform that we launched and are partnering with some of the teams on this call today, as well as other healthcare providers and non-healthcare providers, to really look at technologies that we can embrace, technologies that have a use in the healthcare platforms. Some of those we won't disclose at this point in time because they're still in early stages, but I will tell you that there are many platforms out there, whether it be in healthcare or whether it be tangential to healthcare, that have healthcare tentacles that can really be used in that as well. So we are in the process of that. We have a huge focus. We have people that are dedicated to looking at this. And so I really think we're going to see some great growth shortly in those areas.
That's fantastic to hear. So thank you for sharing.
Yeah, I'm happy to sort of round that out with the work, again, the great accelerator, right, of COVID and what that has done for adoption of technology in healthcare cannot be underestimated. And we've done a lot of work over the past 18 months with federally qualified health centers who both the FCC and HRSA have provided funding to those entities to really help them sort of make this transition of, how do we support our patients when they're not in the clinic, right? And knowing that being able to get to a clinic appointment, it is difficult for people who are receiving care at those entities, whether it's transportation or childcare or time off of work. And so this ability to give them alternate ways to be connected to the clinic is so important. So that has sort of, in my mind, allowed them to start to experience and imagine what that could be, right? And that's pretty simple, right? I have a patient with poorly controlled diabetes or poorly controlled blood pressure, and I now can get additional data points from them in their own environment, which is really important, right? Because all of us know we feel anxiety or stress when we're in the healthcare setting, and the data that is measured there may be different than our data at home in our day-to-day. And so for me, that's important because it's allowing them to build this body of evidence of what this could be to these communities going forward. And so then when we start to imagine more continuous data streams, more algorithm-driven and AI-driven devices, it sort of opens their eyes to the fact that this is possible for these medically underserved communities, and that we can reimagine what healthcare delivery would look like there and not be limited to the constraints of sort of this episodic fee-based model of healthcare delivery that I think really has been constraining over the past decades of healthcare in the US.
Yeah, based upon all this conversation, even though based upon focused on 5G and health equity, it really ties into consumer-driven healthcare. It's having the right care at the right place at the right time. And I think all of these initiatives really support a sustainable move towards that goal. So thanks for sharing. I want to take a minute now and kind of switch gears a little bit. I recently read an article about a prediction by a care coordination company CEO that in 5 to 10 years, homes will be configured to operate like a virtual primary care clinic, quote unquote. I'd love to get your all's thoughts on whether you prescribe to that prediction, what you think it will take to get there, but how far do you envision this going in regard to moving care out to different settings?
And so I'll be happy to jump in to try to answer that from at least my lens, and that is, I don't think anything is absolute. So I don't think we're ever going to have a hospital, a complete hospital in your home, no doubt about that. But I think that we will see incremental steps to growing to that. When I think about some of the things that Apple has done with their watches and continue to reinvent themselves in that space, things I would have probably not even conceptualized 5 or 6 years ago, right? When you think about some of the things, the technologies that others, including Lucy's team, things that are being placed out in service to the patient at their home, it is much more significant now than I would have even imagined, again, 5 years ago. So I would tell you that patients receive some of the best care when they feel safe, and you feel the safest in your own home. So my belief is that we will continue to see that shift and that move to more of not so much maybe the hospital at your house, but at least a place to recover safely. And I think technology will be an enablement, because as Lucy pointed out earlier, you can't have recovery at your home if you're taking very short bursts of data 4 or 5 times a day. It's a much more delicate but intricate solution that you have to provide from a technology standpoint at the home in order to provide that service. So I think we're still very young in that stage, but I do believe over time we will see that grow.
Yeah, and I think to follow up on that, there's so many things that are possible today from a technology point of view that aren't used broadly in the market for other reasons, right? And just the reference to the Apple Watch, right? And the ability to detect, abnormal heart rate and AFib and patterns. I mean, how many healthcare systems are leveraging that for patients who are discharged home to help detect, AFib? Like probably 1%, right? So I always think about there's the what's possible, and then in a prediction like this, what are the other factors? And, to go back to sort of that health literacy issue, right? And digital literacy, what needs to happen in these communities to both understand and trust technology like this, and therefore be willing to use it for their benefit? But I think that's a major issue. And then I think the, healthcare at home, we have to not forget the physical infrastructure of, so you have a patient at home who this monitoring system detects an early warning sign or detects some decompensation. Is there EMS in their rural community? What are you going to do about it, right? Because the last thing you want to do is give that patient the reassurance that we're monitoring you at home and we knew everything about you, and then not be able to get help to them in the right time frame. So I think there are other infrastructure issues like that that will play into how we get from here to there.
And maybe if I could just jump back in and play off that, because Lucy brings that up. When you think about some of the other constraints, and again, being very pragmatic, you need a connectivity that's always on. You need power that's always on. And we've seen that over and over, whether it be hurricanes in this area, fires in the West. Power is an issue as well. And so you have to sit down and look at some of that aging infrastructure and make sure that it is stable enough to provide services to our patients. Because if not, then you are giving them a false sense of security, and that's not a good thing. So I just wanted to echo Lucy said, exactly what Lucy said, is that the infrastructure is going to be key over the next 5 to 7 years to provide the stability needed to provide the services.
Yeah, any thoughts?
Yeah, I'll take a little bit of a different angle on it from a consumer standpoint. I think patients are looking to have more of a Amazonian-like experience at home, right? And so in a couple of national health systems I've talked to, they're viewing it as primary care is going to be moving to the home. And I'll date myself from a clinician standpoint, is I remember patients coming in weekly for their PT/INR draws, through venipuncture, and then all of a sudden, in rural North Carolina where I first started, all of a sudden magically we get, a finger stick machine or finger prick machine. And then after that, it was, doing A1Cs. So I think that as, wearables, remote monitoring become more advanced, we're even in conversations with some device companies that are trying to monitor patients' vital signs without having a wearable on them. And so having all that data and connectivity, and as long as we have power, I think has a tremendous angle on, what's going to be next. And Bill alluded to it earlier on, 3G to LTE, right? I mean, that gave the rise to organizations like Uber and Lyft. Before everyone was taking taxis everywhere, and now you get that. And in a separate conversation Bill and I had, not many people remember Netflix being on DVDs and CDs, right? Now we're streaming. So I think just that forward progression of what's going to happen is going to depend on, a lot of variable metrics, whether that's information security, data transmission, reimbursement rates, other regulations as well. But at the same time, providing that optimal patient and customer experience for health systems that are willing to engage the patients where they want to be met.
Great, thank you. Yeah, Bill, I think you raised an important point in terms of the other hurdles or barriers that may actually be out there beyond bandwidth and having edge devices that can provide information data back to drive integrated care plans. What are your thoughts in terms of you mentioned the power grid, for example, but what are your thoughts in terms of other barriers such as security barriers or government legislation that may restrict productive solutions from being rolled out in a more quick and effective way?
Yeah. So just to jump in on that, I think there are many hurdles that we will have to overcome. We already talked about some with bandwidth itself and then power. Those are basic needs on the Maslow hierarchy of needs, and certainly at the base. But when I think about some of the things that Jeff just mentioned, the evolution and almost a revolution when you think about Netflix and what they did in the early 2000s to deliver almost a completely new service. I think we're poised in that same area now with a few constraints. And one is what you just mentioned, and that is from a security perspective. Security all the way through our infrastructure is going to have to be significant, right? We see this all the time. We continuously put up barriers to make sure that we keep the bad guys out, as everyone says. I know that from a T-Mobile perspective, that they have done significant investments, as well as other carriers, in making sure and shoring up their security platforms. And it's just the nature of what you have to do from a 5G perspective to bring that technology to bear. I know within Wellstar, we are continuously looking at security, our different platforms, how we're going to evolve security. But I will tell you, that's going to be a huge component for us over the next 3, 5, even 7 years, because the bad guys never sleep. To be quite honest with you, that the data mining that is a part of healthcare can be significant, can be costly. And so we are always vigilant about that, but it is going to be a big push for us. And I do believe to some extent, looking at the legislation surrounding privacy and security, that we'll have some challenges on that front. But I'd love to hear from Jeff and Lucy on this as well.
Yeah, and I think in today's age and environment, to your point, Bill, is that no one is immune to cyber attacks, as we've seen in last year, and obviously us as well, right? And so I think by having partners and continually optimizing your security protocols, but then also looking at what 5G could bring to the table for systems like Wellstar from a data security standpoint, is a lot of vendors are occasionally hampered by trying to access hospital-based Wi-Fi. So if we can eliminate that as a barrier to entry from a go-to-market standpoint for some of these startup companies and organizations, by enabling them with cellular enabled devices, routers, hotspots, chipsets, whatever the case may be, and perhaps that helps you all out from a security standpoint, right? Because now you're eliminating folks that want to be on your network from a software firmware upgrades and firewall blocks, right? So you look at that angle from a cellular perspective, and then now we're alleviating bandwidth. Now you have more speeds and less latency for things that you all have to run. And if we can start that shift, and again, those are projects we're working on currently with EICU devices and imaging companies to see if we can help systems decrease their need from a bandwidth and put it over a cellular network. Obviously, as long as we have the up and download speeds that are going to be required for those applications.
Yeah, and to bring it back and build on those comments back to the health equity issue, I think we've seen during the pandemic the issues of trust with our healthcare system in certain communities that have created barriers to care and barriers to vaccine adoption specifically in those communities, and that those are long-standing issues in certain communities that require a tremendous amount of work to overcome. And so as we think about expanding care outside of the hospital system into the home, what are those privacy and trust issues in those communities that we need to address, or else we will propagate the access issues that we have in our current health system today, and we'll just repeat it in the digital world. And I think one of those from a consumer point of view is privacy, and really making, that huge block of text, click the box to sign up for this, that most of us in the industry don't understand, and certainly a lot of consumers don't understand. There's a lot of conversation, right, around how do you regulate that? How do you require people to explain that in human readable form that the average consumer knows what's happening to their data? Because I don't think we'll see the kind of adoption of these digital and mobile, technologies until we build that trust, and part of building that trust is through transparency.
Sorry, Greg.
Go ahead. No, go ahead.
I was gonna say it brings up a great point on who's listening and when, right? Because now we have this thing listening all the time. We have your other products that are sitting in the home that play music, but they're also are being promoted for medication alerts and reminders and connectivity with family and loved ones, which is all great. But to your point, what are they doing with the data on the back end, and how do we ensure up to trust with the patient? And again, from a consumer side on what's their data being done, and why are they receiving ads for XYZ prescription pill, direct-to-consumer marketing from pharmaceutical industries or device companies, right? And, how do we insulate those folks to make sure that, they're quote unquote left alone sometimes?
And maybe just to add one other lens on this, and again, it's never safe to have the technology officer talk about reimbursements, but I will say that ultimately, you also have to figure out how to pay for this. I mean, because there is no free lunch, right? So whether it be the connectivity that is 5G, whether it be televisits and how the reimbursement happens, it really echoes something that Lucy said early on in our conversation is there's got to be a methodology by which reimbursement happens and that people at least break even on these solutions. Not necessarily make money, but you've got to at least break even in order to have that consumer adoption. And so I would tell you that is probably, in my mind, one of the biggest challenges that others are much more intelligent to solve than myself, but I can see that as going to be a barrier over the next 3 to 5 years.
Yeah, I think we've just talked, kind of focused the conversation around consumer adoption, whether it's through reimbursement and cost management or establishing trust within the system. Are there any other thoughts that you have in terms of what would help? What would be the key to a sustained engagement? Key to sustained engagement in terms of adoption of the new ways to deliver care? Is there any other factors that you consider must-haves in terms of engagement and adoption?
Maybe to build on what Bill said, right? I mean, it comes down to what's in it for everybody and what does it cost them, right? And so, what's in it for the consumer? And, have we all now had the opportunity to access some form of telemedicine over the past year and a half? Most people have. And it's great. It's great to not miss a half a day of work and go down there and, pay for parking and wait in the waiting room and all those things and just be able to zoom into your doctor. That's great. But if I start being charged copays on that, I start being charged copays for people who are remotely monitoring, I start getting advertised because my data is being shared, right? Then all of a sudden that motivation, sort of the cost benefit ratio to the patient changes. I want the convenience, but what am I willing to give up for that? And I think it's the same on the provider side, right? There is no magic pot of money to pay for technology in healthcare. I've learned that in this journey. And
Really?
It's shocking, but very disappointing. But there's
It is shocking.
Pot of gold. And so there has to be reimbursement. There have to be efficiencies. There have to be a lot of incentives to get the whole system to change to this new model of care. And it's not just the money, right? It's those very, very busy nurses and PAs and doctors who are asking to do this activity. What are they not doing because they're now doing this? Because they can't do everything.
And I'll be short and Bill, to your point earlier about hospitals and from a revenue standpoint and who's going to pay for it. I think, most hospitals are operating on a 1 to 3% margin, right? And Lucy, to your point, I think the average deductible now for patients is roughly around $8,000. And so if you're getting that remote patient monitoring bill, telemedicine bill, and it's, a very elevated cost amount, there are folks coming into the market now that have various programs that don't require insurance. And so, a national retailer now has, substantial discounts for a physical exam and behavioral health services. And so it'll be interesting to see what happens and how we adjust, whether that's capitation, value-based agreements, and again, trying to flip the switch from a maybe fee-for-service model to more value-based care.
Yeah, I would echo that it's about value, right? When you think about somebody, and again, telemedicine is a great example, the value of being able to stay in your home, the value of not having to take a half a day of work, the value of receiving that prescription through an email or a MyChart notification, and then being able to pick it up in 5 minutes from your house. There is a value to that in a lot of the ways that Amazon's value proposition is. I can click on something that I probably don't need and have it delivered within 24 hours. But the truth of the matter is that value-based proposition is something that we've got to prove, that we as every domain that's represented here, we've got to bring that to our patients to let them see that value. it's a daunting challenge. It quite honestly is, but I think we're all up for it over the next 3 to 5 years to make that happen.
Yeah, that's great. Okay, so we're getting a little close on time. One quick ask. The way that we've worked in the past has been a race, especially on the technology front, is a race to be first to market or a race to have unique capabilities. In order to deliver on this promise of health equity, it's going to require collaboration and close coordination across industries and across companies. How do you all see or view, or how are you approaching the need to collaborate to deliver an integrated solution as opposed to being able to be first to market on your own?
I could start on that one, Greg. So at T-Mobile, again, we're engaged on multiple projects with health system payers, providers, life science organizations, et cetera, across the board. And we also have an accelerator program. And so we're part of the, Peachtree Corners down in Georgia Tech as well, and trying to, co-collaborate and look to see, what we can do from a connectivity partner as well as an organization to see if we can address a lot of these health equity needs to, make it simple, make it cost effective, make it efficient, and improve upon the quality of care and the patient experience.
Great, thanks.
Yeah, I'm happy to chime in. So, I'm not in the medical device business, right? And a lot of what I've been talking about is how we facilitate the data flow from a patient in the home who's using a device that a partner is making that has a chip that a company like T-Mobile is, so it is inherently collaborative because it's so complex. None of us can do all of this. So we all have to sort of work together and to some degree stay in our swim lanes, right? What do we do well? We're really focused on the workflow and how clinicians use this data, but we're totally dependent on partners who facilitate the collection and transmission of that data.
Yeah, I would tell you at Wellstar, it is about collaboration. It is about working with partnerships. One of the things I mentioned earlier is Catalyst by Wellstar. Just that innovation arm started literally 4 months ago to help stimulate and bring this collaboration to the forefront. We will not solve this independently. We will have to solve this as a collective whole. And so it is very paramount that we focus in on how, and I love what Lucy said, how we stay in our swim lanes and understand what's on either side of us as well to make sure that we partner together to deliver a solution for our patients.
Great, thanks. Okay, so I think we're just about out of time. I want to thank all in the audience for joining us today. As you can see, technology and innovation enabling equitable delivery of connected care services to those who have difficulty accessing care is well on its way. 5G and integrated technology, collaboration across organizations, bringing value to patients and customers are all clear factors that are going to really help us drive a successful migration to a new way of delivering care. I'd like to thank our panelists, Lucy, Bill, and Jeff, for their time. Really appreciate it. And I'd also like to thank the team at Health Connect South for providing us with the opportunity to bring this important topic to you. Please feel free, those of you in the audience, to email me at greg.jungles@atdc.org with your questions, and I will work with the panelists to make sure we provide prompt responses to the questions that arise. Thanks a lot and have a good day.